Welcome to What the Health? The podcast where anything health is fair game. There's a lot of garbage advice and misinformation out there that can leave you feeling stumped and stuck. Together, let's sift through the sea of BS and find the best ways to get healthy and stay healthy. Join the team as we tackle the trends and bust the myths about health and wellness. Here are your hosts, Dr. Dan Turo, Angela Turo, and Dr. Riley Brown.
And welcome to another episode of What the Health. I am Dr. Dan here with my co-host,
Dr. Riley.
Welcome back, everyone. Today we want to just remind everyone that anything we say on this show is not to be intended to diagnose, treat, or do anything without the understanding of your trusted healthcare provider. But today we're going over a case study. So pretty much everything we tell you is directly out of our office. So if you have any questions, there are going to be links in the below the podcast so that you can click and actually see some of the images that we're going to go through that Dr. Riley is going to bring up. But this is, we'll call him what? Patient E?
Yeah, that sounds good.
Patient E. But this gentleman, younger gentleman, right?
21.
And is 21. Okay. In school. One thing that really stuck out to me with this case, when you come in, we do a very thorough health history. It starts with our intake form, right?
Yeah.
Like we have a pretty thorough intake form where we go over, what's the history of, why you're coming to see us, the history of your health, anything that you've struggled with, not just what you're coming in for, but any health challenges you've struggled with. Is one of the things we see with chiropractic care is that, right, where, maybe they come in for one thing, neck pain, headaches, or whatever, but 5 other things will start to improve. So, so with the one thing that really stuck out with this individual was his anxiety, right?
Mm-hmm.
And we see that a lot, I think, with whether it's racing heart rate, palpitations, like a shortness of breath, just can't get comfortable. That's really what stuck out with this individual. So, was there anything that you remember with this gentleman that?
I think, I remember him saying something about, he's never really been much of an anxious person, but then he started having this acid reflux and this heart palpitations and stuff like that. I think just very overwhelmed with all that, and then the anxiety kicks in, and that just kind of took over for him.
Yeah. So, so he came in because he also had some like neck issues, right? Like neck pain, discomfort,
like tightness in the back of his throat. He had sinus surgery. I think it was a year or 2 ago.
Yeah.
Just kind of nothing really settled right, having a lot of tightness in the back of his throat.
Yeah.
So that was, I think, his main complaint, as well as acid reflux.
Yeah. So, and again, he found us through a search, right? Just Google search, and again, with the specificity of what we do with some of the scanning, the infrared thermal scanning and the motion X-ray, we're really able to analyze the body in a way that, maybe your average medical doctor or even your typical chiropractor, aren't looking at in the same way. So we get a lot of those difficult cases that come into our office. And this was one of those, where we were able to analyze, really how stressed his nervous system was through that thermal scanning. And then pretty significant flattening of his neck curve. We always talk about you have a nice healthy curve looking at your neck from the side. His was very, very flat. Yeah. And again, you'll be able to see these images if you click the links below the podcast. But we're not high tech enough yet to pull it up on there. We'll get there someday. But yeah, go over like what you see on the X-ray. And we can discuss that a little bit more, some of the things that stuck out for you.
Yeah, so just off the initial X-ray, we call it the military neck. He's straight up and down. You're supposed to have a decent curve through there, and like
banana curve, right?
Yeah, banana curve, and you'll see if you follow the link. Within 2 months of care, it's not perfect, but we have it almost at least the top section of the neck almost to that perfect curvature.
Yeah.
That was only 2 months of care. So with ongoing care, I don't doubt that we would have had that lower portion lining up with it too. It's when you have a straightened neck like that, it's the spinal cord is supposed to be over a curved spinal column.
Yeah.
So when you get that straightening, you're adding, maybe millimeters, maybe a couple centimeters, but that's a lot of tension on that spinal cord. So, and that's why I love that we do the thermography scans, because that just is a reflection of how overtaxed and overworked the nervous system is.
Yeah, one of the examples we always use in the office, right, is if you take a bow and arrow, right? If you're, if you're an archery person, so you take a bow, and the curve of the bow is nice and healthy. And let's not talk recurve. Let's talk about the old school bows, right?
Yeah.
But you've got a nice curve in the bow, and then you've got the string that is attached on either end. And so if that bow starts to straighten, you're actually increasing that tension on the string. Yeah. And that's what you just mentioned with if your neck actually starts to flatten out, you've got increased millimeters of distance that are added to that spinal cord. And again, we're not talking about, your spinal cord's going to snap, like that's unreasonable. Yeah. But, when you add, these millimeters of increased tension, now your nervous system is already at like a boiling point. And so then, more motion can cause, more damage or more, more neurological dysfunction. Yeah. And that's what we were seeing with him reflected in his infrared thermal scans. He had a lot of, the broad term is dysautonomia, or, a dysfunction in his autonomic nervous system. And the autonomic nervous system is what coordinates a lot of the internal organ function. Yeah. So your digestion, your breathing, your heart rate, your immune system, all of that is coordinated through that autonomic nervous system tone. And so when you increase that tension on the system, then you're just at that heightened state of, anxiousness. There's really anxiousness, tension, tightness. And you can see that in people where they just, even those, patients that come in and they're just like, they're jittery, right? It's like they can't, it's like a, little toddler that can't sit still in the candy store, right? It's like, they're constantly moving their legs, they're tapping their fingers, and, they just can't get comfortable. Mm-hmm. And their system is just at this high state. Like it's, it's tense and it's ready to be sprung.
Yeah. So I think that's what I noticed too with him is the initial evaluation. I love when patients want to talk about their history and stuff. Like he had a lot that he wanted to say, he just wanted to continue saying too. And so I could just tell, like, one, it meant a lot to him, like some of the things that he has going on, but two, like it's almost like he couldn't get enough out. He just wanted to say more and more and more. And I just think it was kind of a, maybe the anxiety was kind of coming out of like, I have all this help me, in some sense. Yeah. I think, by the end of it, he's 21 years old. He's going to have a lot of energy, but he was rather mellow and just kind of not on cloud nine, but he was, in a great state of mind by the time he was 2 months into care.
Yeah. Yeah. He was just, things calmed down. He was able to have a conversation without being so, amplified. Yeah. Jacked up, I guess, is the term we use in the office, right? So what's the, so he comes in, first of all, I know I love working with that, that population younger than 21, right? Because we always talk about spinal maturity. So spinal maturity is when the spine, and your entire skeletal system, all 206 bones in the body, basically, all the growth plates are closed, nothing else is growing. So the spine is done growing. The tension on the ligaments and the muscles and the tendons have basically reached their capacity of where they're done growing and developing. Yep. So you've kind of hit that tension on the spine, barring any injuries. That's kind of where you're set for the rest of your life. And that happens again between 20 to 24 years of age. Females are a little bit younger. Males are, a little bit towards the higher end of that 20 to 24. So when we work with individuals, and this is why we tell parents all the time, like, hey, you should get your children checked. You take your children in to get their teeth checked, when they're 2 years old and the teeth are just popping through. Yeah. But a lot of people don't get their kids' spines checked out. And, we can see some very, very nasty curvature and tilt and distortions in the pelvis and the lower spine that can be corrected relatively easily, with very, very good specific targeted adjustments. So I love that, when the individuals come in who are younger than that spinal maturity age, we tend to be able to make the biggest corrections. Even like, I always say like 8 to 13 is when we can see some of the biggest, most drastic corrections. Yeah. But yeah, there, we forgot to turn the phone off. Yeah. We can only do so much without a crew here. This is low budget podcasting. But anyway, so he came in, he's 21, unfortunately he had the symptoms that drove him in, right? Yeah. And we'll bring that up to patients, right? Like, a lot of times they'll be coming in with something, but the symptom is what made them make the original appointment. Yeah. So I always say, like, yeah, you might be in pain, you might be uncomfortable, but you're the lucky one because you're coming in now with something that can be corrected rather than you don't have any symptoms. Your spine is jacked up and you don't know about it. And now you're 30, 40, 50 years old. And now all of a sudden the big health issue comes in. And so now to be able to slow that process down and reverse it is much more difficult, in the fourth and fifth decade of life rather than, the first or second decade of life. So, so sometimes those symptoms, are kind of the blessing in disguise of like, okay, we're going to get this corrected now rather than it becoming a lifelong issue.
Yeah, I think he, being 21 years old, I remember when I was 21.
That was so long ago for you.
You push that all, to the back. You're like, I'm still young. This will go
He's still in his 20s, by the way.
Yeah, 7? I don't even know what I am anymore. But, you push all that to the back. You're like, I'll be fine in a week or two and stuff like that. And I think for him, it was the case of, I've been battling this for,
a couple years already.
4 or 5 years now. And he had some, endoscopies done. So where they took the camera down and looked at, the stomach and stuff for the acid reflux, and they weren't really finding much. I think he had 2 or 3 done, and they were like, we're not seeing anything really significant. I think that also amplified some of that anxiety and having these acid reflux like pains that they're doing, they're going directly into the stomach and looking, and they're not seeing any issues. And so then, we got put on the medication and all that stuff. I think he was doing stuff for GERD, the acid reflux medication and anxiety medications when he came into our office.
Yeah, didn't it? I believe, if I remember correctly, he started the acid reflux medication. That wasn't improving, but then that brought on, I think, some of the anxiety symptoms, which then they wanted to suppress with anti-anxiety medication. Yeah. So, again, we always say, one medication can lead to 2, can lead to 4, and by the time you're 50, 60 years old, you're on that, average of 5 to 7 medications. Yeah. The average 50-year-old is on 5 to 7 medications in our country. I do believe the tide is starting to change and people are starting to wake up because, the information is so prevalent on the internet. It can be very powerful. It can also lead you down, rabbit holes. Yes. But the information is there to be able to talk with, one another and experiences and, hopefully get you to the true answer. But unfortunately, in his case, it was like he went down that medical route. One medication led to 2, and he wasn't feeling any different. And he was starting to have additional symptoms from the medication that he was on. Yeah. So at the end of the day, so we found that, flattening of the neck. So after we, had this, long discussion, and do we have his infrared thermal scans? Do you have those?
Yeah, up on there? They're up on there as well. Just when you're looking at them, they're reading from right to left. So just a forewarning. That's how we read them in the office.
Yeah. So on the right is the most is initial, this earliest one coming into the office. And what do you notice on there? Do you see
a lot of deviations in the temperature? And when we look at those, there's a straight blue line, and then there's a green squiggly line that kind of is supposed to deviate just slightly around that. When I'm looking at his original, it's, the lower back's got a real hot swing out to the right, kind of cuts back, and then a cold swing in the neck. And it's pretty severe cold swing. It's very, very blue, and I know that's not what we base it off of, but when you're just looking at it, there's no question about it. It's a very big blue swing up to the upper back and neck.
And blue means what? Hot or cold? Cold, yeah. So, and does hotter or colder mean anything different to us in the office?
No, we don't want to see really either.
Yeah, because we want to say, right, within, if the temperature was the same all the way up and down, right? That green line would be straight up and down, right? Because all the temperatures would be the same. But if one area then is 1 degree hotter, it's going to shift to the right and be red. If one area is 1 degree colder, it's going to shift to the left and be blue. So anytime that temperature deviation is outside 1 to 2 degrees, that's outside of normal. And then you're looking at kind of mild, moderate, or severe deviation from the average. And so what you're saying is with his, that really cold swing right in the neck area is indicative of high stress, severe tension on that neurological scan, which correlated with the structural, the decreased structural integrity of his neck. And then that was correlating significantly with his symptoms. So.
Yeah, it was all correlating very, very. It was like a picture perfect case for us. I think this is probably why we're doing it first, because it is one of the easier ones to talk about. And by the end, on the very left of it, I mean, it's almost an ideal scan. Down, I mean, there's a little swing at the very top, but compared to where he started, I mean, it's magnificent of a change. And
and he had come off all his medications at that point. And again, we don't diagnose. We don't put people outside of our licensure. We don't put people on or take people off medication. That's outside of our licensure. However, we do talk about, as you start to restore nervous system integrity through spinal adjustments, your body is going to start to improve its function. So, where the symptoms you were trying to manage with medication before, you might not need to manage it as much. So you might need to reduce those or come off of those. And that's always under the recommendation of the prescribing doctor. And so, he went back and talked to them, or he made his own decision to stop them. Again, I can't stop someone from making the decision on their own stopping their medication. But it's, it was a very, very interesting case. How quickly he responded within 2 months.
Yeah, it's not a typical. I mean, he's young, but with as severe of a straightening, I mean, we typically do a re-exam 1 or 2 months after the initial visit, and taking his X-ray was just kind of, you took a step back and you're like, oh my gosh, that big of a change. But so it was definitely interesting to see, so to speak, in terms of the structural. But he is 21, so that's what we even say with kids, like they're typically a couple of adjustments and then
see some big changes.
You see some big changes.
How does that feel for you, for being a young doctor, just getting into this, where again, because it's like you go through the first couple of years of school and it's like you're learning so much for the boards and so much everything else that's not directly related to what you're going to do day to day. And so now that you've been in the office as a doctor for nearly a year now, and seeing a lot of these cases and the objective changes, how does that feel from your confidence level of like, we're going to figure this out?
Yeah, it's rewarding. It definitely boosts your confidence seeing a lot of these changes. Also, I don't have to work as hard to ensure trust into the patients, because I can show them these objective measures and say, like, here, this is what the body can do if you put the correct force into it and all that philosophy. But it really does kind of, it's rewarding, makes you want to do more, do more of it. Getting to that 2024 range, I think is a big challenge, I think, because like I said, you just throw that, I have some pain, it'll get over it. But seeing a case like this, hopefully being able to show a little bit more of that younger population and get them to, hey, you might feel okay, but your spine could look like this. And that could lead to multiple issues down the line.
Yeah, and I think that's, again, from a communication and more of a public health awareness standpoint of like, look, you have so many different health team members, right? You've got your, dentist for your teeth. You've got your, primary care for, doctors for overall, disease management and just checking to make sure that you don't have anything major popping up. But really, like, who's looking at your spine and your nervous system on a regular basis? People would argue like, oh, I go to my neurologist, but how often do you see a neurologist? Like, usually you're only going to see a neurologist, under you've been to your primary care, you've got something neurological showing up, and they do a quick assessment and they're like, okay, now you're being referred to a specialist because you have something severe showing up. Whereas in our office, we're analyzing the integrity of people's nervous system all day long. when they're coming in with those thermal scans. Now it's one specific measurement, but we're looking at that and seeing changes and improvements over time.
Yeah.
And the younger you can do that, the better off you're going to set the stage and the foundation for your health and well-being long term.
Yep.
So the old adage, right? The ounce of prevention is a pound of cure. So getting yourself checked if you're, in that 20 to 24 years of age. And if you're younger than that and you're still living at home with mom and dad, it's like, hey, mom and dad, get your kids checked.
Yeah.
Because, whether they're athletes or whether they're musicians or they're just students and, interested in whatever, they're just running around playing, like just, getting them checked because it's so easy to make those corrections, when they're younger than 18, rather than, the repetitive stresses that we deal with and lifetime stresses that have accumulated throughout our life when we hit that mid 30s, 40s, 50s and beyond. Yeah. Awesome. Was there anything in Patient E's words that you wanted to share that really struck you towards the end?
Yeah, we have his, his review that he posted for us, and just the very first sentence is, Dr. Dan and Dr. Riley have truly changed my life. And just hearing that, you kind of,
humbled.
Yeah, humbled for sure. He said he went from having bad anxiety with a lot of symptoms. I think he kind of, his main focus was that anxiety, which is interesting to me because I don't think that was the culprit of all of his symptoms. Yeah. But that symptom was the one affecting him, I think, the most.
Yeah.
And so, he said he was having that anxiety with those symptoms, almost nothing within just 2 months of care. So he was very, very, very glad that we could help him in such a short amount of time.
Yeah. Yeah. And setting the foundation, I think that's the one thing that, a lot of times, BJ Palmer, the developer of chiropractic, said you never know how far reaching something you think, say, or do today will affect the lives of millions tomorrow. And so, in this one case, it's like, you don't know, not correcting that, how bad or how difficult things could have gotten for him. I know he was, or still is in school, trying to finish up some education to get into a career, to, establish himself, in his relationship and, and career wise, there's a lot of people that get debilitated from a young age, when they're not, when they lose their health, right?
Yeah.
And so, I look at something like that. Now, his is a more severe case with symptoms from a younger age, but, I start to think about things like headaches that start showing up in people's 20s, after they're done with school and, they're done with their sports and they're not exercising as much and they're sitting in front of a computer all day, stresses of work and school, student loans and mortgages and, all this stuff starts accumulating, relationships, and it's just all this stress starts accumulating and their body, you reach a point where you just can't handle it anymore. And then it's like, okay, well, you go to the medical doctor and it's like, well, here's a pain medication or here's an anti-anxiety medication. And sometimes you don't even need to go to the doctor anymore. Like there's all this over the counter stuff that you can just get. And, really you're just quieting those symptoms and you're kind of kicking the can down the road. They might allow you to function in the meantime, in the immediate, right, that instant gratification in the immediate short term. But, what else is your body continuing to kind of degenerate or, go through this path of dysfunction, and how long can you continue to do that until the big health challenges, right? Yeah. I just had a woman from church who came up to me the other day when we were there for pancake breakfast after church. And she said, my son, and so I worked on her before, her and her husband in the past. And she said, my son, who my wife and I went to school with, had a heart attack at 40 years old. And so it's like, holy cow, that's significant. Yeah. I mean, that is very significant to have a heart attack that young. So, so you really want to, you start to look at, your health. Again, I think we take advantage of it, when we're so young and, that 18 to, 32 range, where we really just take advantage of, of things, and we just hush things and kind of push things back. But it's like, if you don't take care of your health now, right? One of my favorite sayings is, if you don't take time for your wellness, you'll be forced to take time for your illness. So
Yeah.
it's just, this is just such a perfect reflection of how things can be changed, with relative little intervention. And then again, once you get that momentum moving, you get some adjustments, you're feeling better, your anxiety's coming down. Now you're motivated, pain level calms down. Now you can start to maybe go out and exercise.
Yeah.
And now because you're exercising, you're moving, you're motivated to eat better. And, now your relationships are improving. Now all of a sudden you're performing better in work, and, now you're up for promotion, and it's like, health is everything.
Yeah.
I mean, it is so interconnected to everything that we do, that it just, I can tell you one thing: get yourself checked. If you don't have a good chiropractor, get a good chiropractor as part of your healthcare team, because at the end of the day, I think it is so essential to your overall health and well-being. Can you survive without a chiropractor? Sure. There's people that survive, well into their 80s and 90s, 100 years old, and they can go without chiropractic. But we always say it's like quality of life just seems better, when you're well adjusted. How much better do you feel when you're adjusted?
Great. Yeah. I mean, I remember starting in school, and, I'm getting care from a student, but the student's, dad has been a chiropractor, so he's been around it for a good bit of time. I just remember, undergrad, I did good in the education and all that stuff, but chiropractic school under care, I didn't, studying wasn't like a necessary need for me. I just felt like I retained all the information, so I could focus in class and just retained it. So yeah, I feel great when I'm under chiropractic care. I can be present with my family a little bit more. I'm not worried about all these headaches I need to go lay down and stuff like that. I'm able to chase my daughter around the floor and all that kind of stuff, and not have to worry about back pain and all other sort of symptoms.
Yeah. And that's what, I wasn't under any regular chiropractic care until I got to school. And I remember, within the first couple weeks of getting adjusted regularly, my breathing was just night and day difference. I'm like, wow, I'm actually taking deep breaths. Wow, I'm not having these, this chronic flare up of itchy, watery eyes, and these, sinus allergy type symptoms. After every time I ate or drank something, it just blew my mind. And it is it's almost like I woke up one day like, oh my gosh, this is what normal breathing feels like.
Yeah, that's the similar thing for me. I was, asthmatic as a kid. Singular, Claritin, Zyrtec, albuterol inhaler almost every single day. And, got under care. And the pollen in Georgia is no joke.
No.
Georgia
snow.
Yes. You walk out in the morning and you're
covered in yellow.
Covered in yellow. And then, you clean it off, you drive to school, and then you come out from class and it's covered in yellow. And I never had an issue with my sinuses or anything in Georgia, just because I was under routine care. So welly. So yeah, it made a drastic change in, some of the symptoms you don't think would be helped by a chiropractor. I want to go there for back pain. It's like, we don't adjust, we adjust the bones, but that in turn affects the nervous system. The nervous system controls everything. So, and at the end of the day, if you have a symptom, it's probably directly related back to that nervous system.
Yeah, it's somehow coordinated, So if we can get to the bottom of why that nervous system is under stress and remove it, the body is designed to heal. Well, thanks for stopping by. We'll get off our soapbox now. If any of this resonated with you, you're interested in getting an appointment or just finding a chiropractor near you, we have lots of contacts across the nation and the world, actually. I've taught chiropractors, in almost every continent now, I believe. So if any of this resonated, or you're just looking to get healthy and stay healthy, we would love to hear from you. So reach out, ToroFamilyChiropractic.com. Like we said, we'll post the case study review in the comments section so that you'll be able to read and check that out. If you have anyone you or a family member looking for care, please feel free to reach out. I'm Dr. Dan.
Dr. Riley.
We'll see you at the next What the Health podcast. Thanks for stopping by.
Thank you.
You've been listening to another episode of What the Health? the podcast where anything health is fair game, with your hosts, Dr. Dan, Angela, and Dr. Riley. Brought to you by Chiro Family Chiropractic. If you'd like to learn more about some of the resources mentioned on this show, or you have questions about something that was discussed, please reach out through our website at www.chirofamilychiropractic.com. Remember to like and subscribe to What the Health Podcast to catch all the latest episodes and replay your favorites. Thank you for listening, and remember, we're always here to help when you find yourself saying, "What the hell?"